Multiple sclerosis is a disease that presents in many different ways, and it can be very confusing. Multiple sclerosis is a serious brain and spinal cord neurologic disease where there is a malfunction of our immune system in that there is actually an autoimmune attack against the myelin that coats the nerves. It makes our nerves function better. Multiple sclerosis is a disease that can have many different symptoms, and it can be very confusing. With multiple sclerosis, you can have numbness, weakness, problems with balance, problems with speech, problems with vision. Usually they happen on one side of the body. Usually they happen over the course of a day, not sudden like turning on a light, but they can present over the course of a day or so, and then they last more than a day. Usually they last several days or a few weeks. These symptoms can reoccur, and usually there's improvement in between these attacks or flares, but sometimes the symptoms can linger and then you can have disability. The diagnosis of MS can be challenging because there isn't one single test. Multiple sclerosis is diagnosed by doing brain imaging, and specifically MRI imaging of the brain, and also doing spinal cord imaging as well. You can also do a lumbar puncture, but you don't always need to do a lumbar puncture, which is also known as a spinal tap. It's also important to do lab testing to make sure that you're not making a mistake and diagnosing something that looks like MS, but is actually another disease. There are some other diseases that mimic MS, and some of those are worse than MS, and some are better and treatable. One of the exciting things about MS treatment is that we've made a lot of improvement over the last few years. In the past, we had just a few treatments, and they all had quite a few side effects, and they were hard to take. Now, there are many different choices. We have treatments that are injections, or pills, or IV infusions. In the last few years, there have been new treatments every year for multiple sclerosis. And the experience with people that are newly diagnosed with multiple sclerosis is different than it was before. People that were diagnosed 10 years ago, 20 years ago, will have a totally different experience now than compared to people that are able to try these new medicines. Multiple sclerosis is a disease that has varying prognosis. Some people do very well and have very few attacks, and some people have much more aggressive disease. The thing that is pretty exciting about multiple sclerosis treatment is that there are medicines that are more gentle, and there are also medicines that are more aggressive, and medicines that can stop disease quicker. We've learned quite a bit about multiple sclerosis, and so the prognosis is better now. We've actually learned that if you treat disease sooner rather than later, then you actually have a whole different course in your disease, and you end up being better off overall. So early treatment is important. If someone has symptoms that they think could be multiple sclerosis, I would recommend first seeing their primary care doctor. And you can discuss that with them, and they may be able to do some tests and figure out whether you need to see a neurologist. Multiple sclerosis is a diagnosis that needs to be diagnosed by a neurologist.